Good morning, everyone, and thank you for joining us. I'm excited to be here. My name is Albina Rosales, and I'm a pediatric pain psychologist. I work at Children's Hospital Los Angeles, and I'm an assistant professor at the University of Southern California, or USC. Thank you so much for joining us for the Creative Healing for Youth in Pain, or CHIPS, webinar. The title for today's webinar is Behind the Pain, Understanding Fibromyalgia in Youth and Young Lives. For those of you new to our community, CHIP is an online nonprofit organization that empowers youth living with chronic pain to heal by attending to the brain's pain circuits through exposure to creative healing experiences, educational resources, and peer support. Today, I have the absolute honor to present to you one of the greats in our field, Dr. Susmita Kashikar-Zuck, who is a clinical psychologist and professor of pediatrics in the Division of Behavioral Medicine and Clinical Psychology at Cincinnati Children's Hospital Medical Center. She's an associate director of the Pediatric Pain Research Center and founding psychologist of the multidisciplinary Pediatric Pain Clinic at Cincinnati Children's. Her work in pediatric pain focuses on understanding the best ways to assess pain in children, on holistic treatments for complex chronic pain conditions in children, including coping skills, training, and novel exercise-based programs. She's also working on what happens to young people with chronic pain as they transition into adulthood. Dr. Kashikar-Zuck has published over 140 scientific papers. She is an associate editor for the Journal of Pain and has received continuous funding for her research for over 25 years. Please join me in welcoming Dr. Kashikar-Zuck.
Thank you, Dr. Rosales, for that lovely introduction. And I'm thrilled to be here today. I will first share my slides so we can get started from there. Okay, wonderful. Thank you all. I am so honored to be invited. Thank you, Dr. Zelser and the CHIP community for inviting me to speak about fibromyalgia in young lives. So as Albina said, I have been working in this field for over 25 years now, and really I selected the title for this talk, Behind the Pain, because that's what I have been trying to do all of these years. I have been trying to understand a little bit more about complex chronic pain conditions in children, how it impacts young people, their families, and also what are some of the underlying causes and how can we best treat these conditions. So first of all, greetings from Ohio, where it is the afternoon here. So good afternoon to those of you on Eastern time, and good morning to the rest of you who are on the West Coast. So this is a picture of the lovely city of Cincinnati across the Ohio River. This is actually from the Kentucky side. We're right at the border between Ohio and Kentucky. And this is looking over into downtown Cincinnati. And then on the top right here, that is the research building at Cincinnati Children's office. Cincinnati Children's Hospital. My office is on the second floor. This is our hospital building. So just to give you a context for where I am, I have no disclosures or conflicts of interest to report related to the presentation. I do receive funding from the National Institutes of Health for my research, as well as the Childhood Arthritis and Rheumatology Research Alliance, which is CARA, along with the Arthritis Foundation, and the Cincinnati Children's Hospital Research Foundation. So today I thought I would go over a few things with you. It's starting with some of the controversies surrounding the diagnosis of juvenile onset fibromyalgia in young people, because that is an area that is still sort of in debate in the pediatric community. So I wanted to share with you a little bit about some of the discussions going on around that, and would be interested in your thoughts and questions too a little bit later in the talk. Then I will tell you a little bit about the clinical features of fibromyalgia from our research and others, and the impact on the lives of teens with fibromyalgia. And then tell you so far what we know about the biology of fibromyalgia and about the options for treatment approaches that are currently available. And then if we have time, I'll tell you a little bit about one of my favorite topics, which is talking about the Fit Teens clinical trial that we just completed, and also some thoughts about the next steps for our research and treatment in fibromyalgia. So I'm going to start a little bit backwards here. I'm going to tell you a little bit about what we heard from young adults with fibromyalgia. This is when they're in their early 20s. So this was from a qualitative study that we conducted where we approached young, primarily women, who had been diagnosed with fibromyalgia when they were in their teens, and asked them to kind of look back and tell us a little bit about what it was like for them, the whole process of being diagnosed and what they were thinking about, what they wish they knew, and what they would like to say to other teens who were living with this experience as well. And so I'll sort of start on the left side here, and these are just quotes from some of the conversations we had with them. One of the young women said, my doctor didn't really understand how to manage my condition because he didn't really understand it either. And this is oftentimes what we hear, that there is uncertainty regarding the medical cause for fibromyalgia. And so some people are unsure about how to go about treating it. And so this uncertainty obviously is communicated to the young patients. And so they're like, well, my doctor didn't really know what this was about. And so as a teen, you can imagine this is something that is very unsettling because it's a uncertain kind of diagnosis. So as a teen, I thought my life was over. I got to a point where I got too exhausted to really have friends. The symptoms of pain and sleep difficulties and so on were really taking a toll, and the fatigue on their lives. And, one of the young people said, you kind of want that explanation of validation, like, no, you're not crazy. There is something wrong, right? You want to know that there is something going on here. I'm not just imagining these symptoms. And then in some of the conversations around like what fibromyalgia looks like and how it manifests itself, it helps for them to understand that it is multifaceted. And so when you are planning treatment, you can't just tackle one side of it. You have to come around and take a holistic approach because it is the symptoms of pain, but there are also symptoms of fatigue and the sleep and other things. And so you have to tackle various parts of it and take a very holistic approach rather than just saying, here's a medicine, this will help you sleep better, or, here's a pain medication, and that should take care of the pain, because it is so multifaceted, right? And one of them mentioned that they had actually been to a multidisciplinary treatment program, and just getting that explanation of, how the body feels pain, how does the brain sort of interpret the pain experience, and how is pain related to stress and what's going on in life. And that sort of helped things click for them a little bit more. And one of them actually mentioned, she said, not until this year did I seek mental health help. If I had acknowledged my diagnosis earlier, I might have sought that help a lot earlier. And this was one of the themes that came up because it's really a long process of just sort of even arriving at the diagnosis and wrapping one's head around what they're dealing with. And yet it is also the symptoms are having an impact on their mood and their sleep and just coping with just daily things in life. And so, so they felt it was important to share that, just making sure that you have both the medical team in place, but also seeking, coping sorts of support. And one of the things doctors always recommend is, go to physical therapy, try to be more active, do exercise. And they said that they were getting better at arriving at what was that sweet spot, because exercise is hard. It can be associated with increased pain. So you don't want to cause a flare up, but you want to be able to stay active so that your body stays conditioned and so on. And so they were sort of arriving at this, some years later. So these were just the thoughts, and I deliberately started this sort of later because we wanted people to reflect back. Now, going back to the early years, this is a question that a lot of times comes up in even in my presentations and scientific meetings, is why is it so hard to diagnose fibromyalgia in young people? And it was only really relatively recently. I'm old, so for me, 1980s sounds relatively recent, but that was probably before many of you were born. Um, so, but it was only around the 1980s that it became recognized that fibromyalgia can probably affect children and adolescents. And, you may ask me, okay, so how often does this happen? How many children actually do have fibromyalgia? And it's sort of this funny chicken and egg kind of thing, because if you don't have a proper way of actually assigning the diagnosis or identifying the condition, it is hard to know how prevalent it is in the general population, right? But the closest we can get from studies that have done work in schools and in communities, it appears that about between 2 and 6% of school-age children, and so this is generally, children who are 8 years and above, have reported widespread chronic pain. Now, this doesn't mean they have fibromyalgia, but this is that they have symptoms for over 3 months of pain in different areas of their body. So not necessarily something they might seek treatment for, but it is more common than one might expect, having this type of widespread pain. And my guess is about a subset of them will actually go on to have fibromyalgia later on. And so as this knowledge began to come out, pediatric pain clinics and rheumatology clinics began to more systematically identify patients who reported not just this widespread pain in different parts of their body, but they were also having a lot of fatigue, a lot of sleep difficulties, problems with digestion, frequent headaches, problems with attention concentration, and often with joint laxity or joint hypermobility, as it is called in some clinics. So medical tests usually showed no signs of disease or inflammation. And so it was just sort of generally called a chronic pain syndrome. Now, these days, the terms that pediatric doctors use are sometimes not the same, which can get kind of confusing because some clinics might call it amplified chronic pain. Some clinics might call it juvenile onset fibromyalgia or myofascial pain or primary chronic pain syndrome. And sometimes EDS, Ehlers-Danlos syndrome, hypermobility type can also overlap. And so are these all the same? Are they different? And does it really matter? Now, I would say that it does matter for different reasons. One is from the patient perspective. It's like, hey, can you just give me a sort of consistent diagnosis so that when I change doctors or if I'm talking to my other doctors, we're all sort of speaking the same language. And even if maybe the treatment approaches may be similar, it just might help having a diagnosis. And I've talked to a lot of pediatric doctors, pain doctors, rheumatologists, and I'm like, okay, so you have different ways of assigning this cluster of symptoms, and why not just call it juvenile fibromyalgia or juvenile onset fibromyalgia? And the responses that I get are they vary, and some of them are like, well, we don't necessarily want to assign a label of fibromyalgia early in life because they feel that maybe young patients will, be going on the internet looking for information, and they might read information about adult fibromyalgia syndrome and assume that, their outcome is not going to be a good one, or that they're going to be very disabled later in life. And so they don't want them to feel like, this is sort of a lifetime thing. Also possible stigma. So, some of you who have experienced fibromyalgia may have had some experiences with stigma from people in schools or peers that don't understand what it is. So they're worried. They don't want to assign this because of stigma. And the jury is still out. Is it the same as adult fibromyalgia? So these are the sorts of questions that are out there. From my discussions with patients, it seems like many of them just feel relieved when they have a diagnosis, that there is something the matter and that it has a name and it is similar to the adult syndrome, even if it is not quite the same. So yeah, so there it is. It has not been completely resolved, and I would be curious, maybe this is a second we could just stop here. Alvina, I don't know if there's any questions in the chat, because this often raises some questions in people's minds that I wonder if anybody had any questions or comments on.
Yes, one of the questions was related to resources. If people did want to uh, obtain more information on juvenile fibromyalgia, do you have any recommendations on what sites or what areas to seek more information from?
Yes, so there's a couple of places. So again, like I said, not everyone calls it the same thing, but I think the sites that specifically talk about chronic widespread pain in children or chronic musculoskeletal pain in children, those are very good sites to go to. So I know the Arthritis Foundation, for example, has a sort of a pediatric section where you can go and look at widespread pain in children. The other is the U.S. Pain Foundation has a pediatric pain warriors program. They have a lovely website and they have resources there's one for kids with chronic pain and there's one for teens with chronic pain. I think it's called Living Well with Pain for kids, and for teens, they have like separate things you can go into. So to answer that question is, I think because it is a wider term that people tend to prefer to use for children, I would say it's better to go to those websites that are very pediatric specific. And I know CHIP has some wonderful resources as well on their website. So that would be a great place to start.
Great, thank you.
Okay, so so what are we doing about it, right? So, I mean, clearly I have been involved in this research for a while. Why I think it matters is, I think from a research point of view, it is important for us to have clear and consistent criteria, right? So if I'm looking for the cause of a particular medical condition, I need to be sure about what I'm looking at, right? So it should be consistent. We should have what we call phenotypic or, descriptive criteria of a particular syndrome, because the diagnosis is made based on what people tell us, right? You can't see fibromyalgia on an X-ray directly, or you cannot see it in a blood test, for instance. And so it is based on these criteria that in adults, we actually have a set of criteria that were proposed by the American College of Rheumatology. So they had their initial criteria in 2010, and then they published with some small edits. They had some criteria in 2015 and then again in 2016. But the basic criteria are the same, of having pain in multiple body locations, and also a set of other associated symptoms of fatigue, sleep difficulty, other somatic symptoms, and so on. And if you meet those criteria, for adults, it is very easy for us to say, yes, you can have this diagnosis versus not. And there really wasn't any pediatric criteria. And we did one small study looking at whether the ACR criteria for adults can also be used in pediatrics. And we found that with some very minor modifications, it was actually very, very similar, and we could do that. That was a small study. We have just completed a study in 5 pediatric rheumatology clinics. And that is to validate or to standardize these criteria for children. And so in the next year or two, there should be some published pediatric criteria for juvenile onset fibromyalgia. So that's ongoing. These things do take a while, sometimes longer than we would like, but that is where we're at with that. So what are some of those typical characteristics that a person who is living with fibromyalgia or a young person with fibromyalgia shows? If you look at the green part in the center, this is from a paper we published in Nature Reviews Rheumatology some years ago, almost 10 years ago. And really the central characteristic is this amplified sense of widespread pain. So it's almost as though the volume on the pain dial has been turned up, and so even relatively what other individuals might feel as sort of a mild stimulus is really quite unpleasant and sometimes painful. Also, as I mentioned, the fatigue, sleep difficulties, and difficulties in thinking and other somatic symptoms, also dysautonomia or, feeling dizzy, orthostatic hypotension and those sorts of things. And often mood symptoms like anxiety and depression come along with it. And this, if you look at the blue box over there, you can see it impacts practically every domain of life in terms of physical functioning, doing sports, school activities, and difficulties sometimes with peer relationships and family relationships as well. And overall quality of life really does suffer with this syndrome. And many of the physicians I worked with asked me, well, what do we know about fibromyalgia? Do young people just grow out of it? Is this something that is, just sort of a childhood thing? Maybe it's part of growing pains or something like that. And do they grow out of it? And I was like, well, the only way to know is to actually follow the teens that were diagnosed in our clinic with juvenile fibromyalgia, chronic widespread pain, and follow them into their young adult years to see how they fare over time. And so we assessed in great detail their pain symptoms, any other symptoms, how they were functioning in their daily lives, their overall quality of life, and followed them at 4 different time points. And we even did home visits, and we talked to the parents, and we talked to the young people themselves. We had them answer a bunch of questions, in research, we like to do that. And so they did ratings of their pain, fatigue, sleep, all their symptoms. What we found was, and we also had a group that we compared them with that were a group of healthy teenagers that were actually selected from the classrooms of the patients who were seen in our clinic who were living with fibromyalgia. And so we had 2 groups. And in the group that had juvenile onset fibromyalgia, really 100% of them reported having some type of symptoms even well into their early adult years, okay? So we assessed them 4 times. One is when they were initially diagnosed, right around when they were about 15 years old. We followed them when they were in their late adolescent years, around 19 years of age, and then beginning early in adulthood when they were about 22, to the point that they were about 24 years old. And even at this time, many of them, or actually all of them, were reporting having some amount of symptoms. Now, this was not always, pain was not always the most troublesome. So sometimes pain had decreased, but they would still have symptoms of fatigue, or they were having trouble sleeping, or other things, not always pain. But they noticed that when they were very busy or when they were not sleeping well and so on, their symptoms would tend to flare a little bit more, but there were times they could manage it quite well. A little over half met criteria for adult fibromyalgia, okay? So clearly, this is not something most of them were growing out of. They continued to have fibromyalgia symptoms. Although, that may seem like bad news. What I will tell you with the younger people, if it is caught early, and many of these individuals were in treatment over time, And I know these, I'm going to try to make this easy to understand. If you look at this graph on the left side, this line graph, basically this is just pain intensity, okay? Over time, we found that pain intensity was actually decreasing over time. So for some people, a small number had a marked decrease in pain intensity, and it sort of bumped up a little bit, and then the others as a group, overall pain intensity was going down. Alvina, did you want to jump in with a question here, and then I can explain the second part?
Yeah, I was just going to mention that our chat is really lively right now, and the questions for pertaining to these points you're making. A couple questions that came up that are related to this topic. Do you find that juvenile onset fibromyalgia is more easily resolved than adult onset, like we see in other pain disorders such as complex regional pain syndrome?
That's a super, really good question. And the key question is resolved, right? So I don't know at this point, based on what I just showed you, that people continue to have symptoms over time. I don't know that it completely resolves, but with treatment, I think really most of our patients can go on to have pretty normal lives. And what I try to tell them is, like, if you think about something like asthma or something that is diagnosed in childhood, if you find the right medicine that works for you and you know how to like stay away from triggers and know how to manage your lifestyle, it is entirely possible to have a very normal life. You may have to make some adjustments and modifications to how you do things, and make sure you're getting enough sleep, or making sure you're not overcommitting yourself in a, but there are different ways that I can tell you the younger people learn how to manage these much easier. I was actually trained in adult pain management, and I did do treatment with adult women and adult men as well with fibromyalgia. And it is harder because you've and when you ask them, many of them have actually had symptoms much earlier, but they were just not caught, and they just kind of kept going. And, they just would push through things and so on. And, you have enough years when you're in your 40s and your 50s, it does become more difficult to treat over time. So definitely, I see this when I'm working with younger people. If we can catch it early and start treatment early, it makes a huge difference. So does that make
Definitely.
sense? Yeah.
Yes, absolutely. That makes a lot of sense to me. There's one more question and we can continue. The next question says that in certain countries, fibromyalgia in adults becomes myalgic encephalitis or chronic fatigue syndrome. And this question is asking if this could also be the case for teens.
You mean, could it be a manifestation of a chronic fatigue
Yeah,
syndrome?
can this
And
also, it seems
yeah,
like they're asking, could this also exist for teens?
I there honestly isn't any reason I can think of that it couldn't happen in teens. There is not a lot of research in this area, but when I first started working in this field and was talking about juvenile onset fibromyalgia, a lot of people were just like, no, that doesn't happen in children. And I was just like, is there any reason why it wouldn't? So for example, if children can get migraines, and if children can have arthritis, juvenile arthritis, you can say arthritis doesn't happen, it only happens in old people. Well, now we know that juvenile arthritis happens, right? It looks different. The treatments may be a little bit different than rheumatoid arthritis in adults, but some manifestation of it could very well exist. So the answer is yes, I believe so. We just don't know a lot about it.
Great. Thank you so much. One more question snuck in, and I think it's really pertinent, so I'll go ahead and ask you it, and then we can move on. Would you consider amplified musculoskeletal pain syndrome and similar, like complex regional pain syndrome, in the same category as early onset fibromyalgia? If so, are they included and decreasing slightly?
If they are they what is the last part of the question?
It says if so, are they included in decreasing slightly? I think I'm guessing what that means is it also kind of expected to decrease?
Okay. So, all right, from the groups that use the term amplified chronic pain syndrome, it depends. They use the term in different ways. It's a very global term. So even something like complex regional pain is sometimes called amplified pain, but localized, right? And so that is what we would call complex regional pain. And then they have amplified chronic pain that is more diffuse, and that would be very similar to what we would call fibromyalgia. So when it is amplified chronic pain and it is in multiple different body areas, and the requirement for fibromyalgia is that it comes with all of these other symptoms like the dysautonomia, the fatigue, the sleep difficulty, and so on. Whereas I don't think that is focused on as much with the amplified pain, because with the amplified pain diagnosis, the focus is primarily on the fact that the pain is widespread. And, that is really the focus of that diagnosis. So I don't think they see that. And from my discussions with patients who've been seen in those clinics, a lot of times they will have a lot of those other symptoms, but it is not specifically called out as fibromyalgia. So are they absolutely identical? I don't know. I just think amplified chronic pain is more of a broader umbrella category, and that fibromyalgia is it is a more specific set of symptoms.
Thank you so much.
Okay. All right, so let's go on to this. Now, what we found was in this long-term study, we actually found subgroups. And over time, so, okay, T1 is what, when they were first diagnosed, when they were teenagers. This is when they're older teens. T2, this is when they're young adults, T3, and then T4. And what we found over time, this is a measure of their mood symptoms, okay? And specifically on depressed mood. And most of them had, just sort of mild elevations, and they kind of stayed more or less the same over the years. Some of them came in with very high levels of depressive symptoms, but I think as they got a hold of, learning to live with some of the conditions and coping well and feeling better over time, their symptoms tended to decrease. Now, we had one group, and that was just about a little less than 15%, okay? So it was just a small subgroup, and they had worsening symptoms of depression over time. So you can see that mental health-wise, this smaller group is not doing really well over time. And what we found was this was the group that really had the most trouble in terms of their quality of life. And many of them were starting to see adult rheumatologists or adult pain doctors, and were in general doing worse as far as their symptoms were concerned. So couple of things, takeaway points, is most people, after they learn to adjust with the symptoms and their pain is a little bit better under control, tend to do reasonably well. But there is a small group that does worse over time, and we really need to catch some of these mood symptoms early so that we can prevent this trajectory from going in a direction that makes it more difficult for them over time. And I've circled this age 19 because I feel something is important going on here. This is the age where young people are just beginning to become more independent, start thinking about college or moving out of the home and those sorts of things. This is a life period that is very, very important. And this is where these trajectories kind of gets baked in and settled a little bit. When people are younger, they can come in with various things, and, they might over time, their mood improves or, but after age 19, people are sort of on this path that we want to catch people before this age so that we can actually have an impact on helping them be in sort of these categories where the pain symptoms have less impact. And this we saw particularly in the mental health. In the pain symptoms, we didn't see a lot of different trajectories. What we were seeing was differences in terms of how they were adjusting and coping with their symptoms. So just keep that in the back of your mind. The mental health issue is not trivial. So it's just something we want to pay attention to. So switching gears a little bit. So what is going on in terms of the possible causes of fibromyalgia? And some of you who have listened to some of the earlier talks and have been reading up on this, you know that something changes in the way the brain is processing pain. And we have been doing a lot of studies with neuroimaging here at Cincinnati Children's and with some of our colleagues who are neuroimaging, neuroscientists, working here at Children's and in Barcelona and in other countries as well, where we're starting to really try to take a deeper dive into what specific changes are happening. And as you know, the brain is still developing, right, in young people. So teenagers' brains are still in this developing phase. And so we have to take into account that the brain is also changing as people get older, just naturally. And so we wanted to first see, how does a healthy teen brain respond to a pain stimulus? Okay, so we had to actually create a pain stimulus. So while they were in the brain scanner, in the MRI scanner, we had this little device that would apply pressure to one of their fingers or their thumb until it became just a little bit painful. And we were watching the brain to see how that would react to that. Okay, so these are healthy children. They have no chronic pain situation going on. And we compared this with adults. So mainly we were looking here just at women, since fibromyalgia tends to affect those who are assigned female at birth. So we looked at teenage girls and we looked at women, okay, adult women, same task. And what you find is that there is actually a difference in the way the brain processes just a very simple pain stimulus. So in the adult women, you would have what we call the primary somatosensory cortex, okay, which is in your brain. So that is the one that says, okay, it's this finger here that is being mashed, and here's where I feel the pain. It was very specific. The sensory cortex lights up, and you can see that the brain is registering that that's where it hurts. Now, with the teens, we saw a slightly different pattern. Not only did that sensory area of the brain light up, but also some of the more emotional areas of the brain. And if you think about it, this is a young person, and this is, one of their early experiences with pain. The brain has to make sense of this. And so there is a tendency for more parts of the brain to light up to try to understand what exactly is going on here. So there are some differences even among healthy people when they are younger versus when they're older. Okay, so we were just like, all right, we had to start there. And then we start looking at teens who have been assigned a diagnosis of fibromyalgia to see now, how does the brain process pain in these individuals? And so we found, again, that there was more sensitivity in the teens' brains, but they were also more hypersensitive than the healthy teens. And again, there were areas of the brain interpreting emotional stimuli that also lit up. And what was interesting was that we found that there was a more generalized hypersensitivity in young people with fibromyalgia, not just to the pain stimulus, but if we had a bright light or if we had a louder sound, they would find that also very unpleasant. And this reflects sometimes what our patients also in clinic will tell us, that it's not just the fact that they have pain, but they are also very sensitive to brighter lights and have other sensitivities as well. So something's going on because we can see it in the brain, right? There is definitely some biologic changes happening. So this was one of our first indicators that this is not something, a young person just said because they wanted to stay out of school or something. It was something real is going on here on a biologic level. But clearly we need a lot more research going on into, well, so what is driving the brain now to interpret these stimuli, painful and non-painful stimuli, in a different way. And so we are now looking at other things like the genetics and the immune factors that may underlie what the possible causes are. So I know we are probably going to be short on time because there's so much to say, but currently, so as far as treatments go, medication treatments are used primarily for symptom management, and that really has to do with managing the pain symptoms. So maybe some non-steroidal anti-inflammatory medicines or analgesics, anticonvulsant medications or antidepressants to try to see if you can have an impact on reducing the pain, improving sleep. The trouble is that the long-term efficacy is still not been determined as yet with these medications, and some patients can be sensitive to these medicines. So if they're used, they're often used in low doses. We do have evidence that cognitive behavioral therapy, or CBT, some of you may have heard of that, it's also sometimes called coping skills training, has been shown to be effective in improving daily function and mood in teens with fibromyalgia. And other people have worked on this, but we finished one clinical trial way back when and published it in 2012, I believe, showing that CBT can be quite effective in improving functioning in teens with fibromyalgia. And these effects last. So an 8-week treatment, but the effects can be long lasting over 6 months, even after treatment is over. So it really trains youth to take on some of those self-management types of skills and manage their condition a lot better. Physical exercise, there's been one small study with aerobic exercise that was found to be useful in pain reduction. And then in clinical programs, we typically use intensive exercise and cognitive behavioral therapy together, and they can work well together, in a clinical setting. And we're doing more work on that on the research side. So the World Health Organization, in their guidelines for the management of chronic pain in children, they really do recommend that treatment is holistic from both a biologic as well as a psychosocial perspective, and that the best programs really offer behavioral strategies or non-pharmacologic strategies, right? So they could be not just CBT, but there are other types of behavioral strategies or complementary techniques that can be helpful, as well as physical exercise. And those are, at the moment, seem to be the most effective, but these do take effort and engagement on the part of the patient, because you have to actually practice some of these skills. And so some years ago, we began developing this Fit Teens program, which is a fibromyalgia integrative training program, because we really wanted to design something that was fun, that was really engaging, and also designed with input from the teens themselves to develop this scientifically based program where we teach some of these psychological coping skills, but then we worked with sports medicine experts actually to help develop a neuromuscular exercise program to really improve movement competence, which is your gait, your posture, your core strength, sort of how you move your body, so that it becomes a little easier to exercise. And we designed this to be a group-based program so that people can get peer support as well as they work through the exercises and the coping skills. And we do include parents and caregivers for some of the sessions. And as we were doing a clinical trial on this, COVID, the pandemic hit us, and we couldn't do it in person anymore. So we actually designed it to be delivered in remote telehealth format and completed the trial. And people were very much engaged. So they're delivered in small group sessions. It takes 8 weeks or 16 sessions. And so it does involve a certain amount of commitment to really hang with the program. But we had 90% or more of our teens. We had over 300 children, teens actually enrolled in the program, and 90% of them completed the program. And we followed them for 6, 9, and 12-month follow-up. So this is kind of what it looks like, where they're learning some of the strategies and the exercise in person. This is us actually practicing when we were transitioning our program to a virtual format. And we completed one of the largest trials in fibromyalgia, in juvenile onset fibromyalgia, just a little over a year and a half ago. And it's taken a while. We've got all our data together. We're getting this published. And what we found was so that we compared the Fit Teens program with coping skills training only and with graded aerobic exercise only. So that was, Fit Teens was sort of that combined program with coping skills and with the neuromuscular exercise. CBT was just the behavioral training. Graded aerobic exercise was sort of a circuit-based program where they went either through different floor exercises when we were remote, or when we were in person, they would do like literally 60 to 90 seconds on the treadmill. Then they would get off, check their heart rate, wait, the heart rate goes down about 30 seconds. Then they would go to the exercise bike. And so they would do different exercises, but they were just short bursts of exercise to keep that more tolerable. And we had really great attendance. What we found, and this was something we did not expect to find, is that actually all the treatments were improving daily functioning across all treatment groups. So even the graded aerobic exercise and the CBT group improved just like the Fit Teens group, and their improvements were maintained over 1 year. And the treatments were safe. The teens had minimal adverse events. Some had some initial muscle soreness with some of the new exercises, for sure, as they were learning something new. But across the board, patients reported improvements in their fatigue, their mood, and lower levels of sort of this catastrophic thinking, negative thinking about their pain, and less fear of movement. And so we're looking at we collected a lot of physical assessment data also that we're beginning to look at now. But the idea that the Fit Teens combines both elements of the behavioral as well as the exercise approach is very appealing, in particular with our doctors who really want the teens to be engaging in a little bit more physical exercise. And this is a very nice, tolerable way to introduce them to the exercise component. And so we are now, making these protocols available to anyone who wants to use them. And physical therapists can easily administer these. And if you have someone who is trained in CBT methods, our protocol is absolutely available. So what needs to happen next? Well, all of these wonderful treatments we have so far are, I would say, very, very helpful in terms of leading a normal life, leading a good life with chronic pain. But they are not absolutely curing the chronic pain and making it entirely go away. And we would all love that, right? If there was just a magic pill that would make everything go away. But we really, before we do that, need to understand more about the underlying biology so we know what we're targeting. And it is such a complex kind of situation because, as you mentioned, it overlaps with different things, with chronic fatigue, with irritable bowel, with migraine. And so we have to know specifically what we are targeting so that we can develop the best medicines for it. The other thing that I'm really passionate about is developing better models, helping transition teens with juvenile onset fibromyalgia into adult care if they need it. And so many times a pediatric setting, often the doctors and the nurses and the psychologists and so on are very used to dealing with both the children, their families, and it's a family-friendly setting. But then when you go into adult chronic pain care, it's often not like that. And to find the right team is sometimes a challenge when kids go off to college, or they are now living with a roommate, or trying to manage their own health care. That becomes a challenge. And what we found is that there's sometimes this gap in care that really needs to be addressed. So I think that is one important area that we need to really work on, and also work on more effective and accessible ways so that people can engage with these type of self-management programs that are out there. And really, I think many people could benefit from those that are not currently receiving them. And also educating our own healthcare professionals, both in primary care and in the subspecialty care, so that they can catch and screen for and begin interventions much sooner than we are currently doing. And then, of course, ensuring insurance coverage. I mean, our policymakers need to understand that some of these non-drug treatments at the moment that are available that can be very effective are sometimes not covered. And depending on the state you live in and the insurance you have and that sort of thing, you know, that can be a challenge as well. So there's a lot to be done. And I am enthusiastic to actually hear from the audience too about what you think is important and what are some of the questions you have that haven't yet been answered, because this is, you know, something that many of us in the field care a lot about, and we also care about what our families and young people think in terms of what the priorities should be. So at this point, I'm going to wrap up, and we have enormous collaborators and, you know, students and people in our lab from these multi-center studies that we've been doing. I tried to really try to just condense and simplify all the work that is going on. And this in the center is just the group of all our trainers for the 15 study. And this is some of our patients who participated in one of our early 15 pilot programs. And so I thank you for your attention, and I am happy to take questions.
Thank you so much. This was such a great presentation. I know the chat's been lively, and I also had some questions that made me think based on things that I've heard also from patients and their families, if that's okay. One of the questions has to do with the diagnosis. Um, it's often the case that patients and their families feel like the diagnosis is a diagnosis that's not really clear, or maybe one that's just given by doctors when they can't figure out what's going on. And perhaps it has to do with systemically, what you mentioned early in your talk, things like criteria haven't always been really clear, and we're going to do better as a field, but it hasn't always been that case. But curious if you have any thoughts on, or what you would say to families that feel that way, that feel that they kind of have a diagnosis when they have a diagnosis of fibromyalgia, but it doesn't really feel quite specific, or it feels like something's missing. Yes, what do you think?
Yeah. Yeah, and you know, that is kind of the way modern medicine and our culture kind of handles these things, right? In some ways. So I know I'm getting kind of existential about this, but you know, we think about things like if there is, like if I have a radiology exam or something like that, I have a scan that shows I have arthritis in my knee, I can definitively say there is inflammation, or it's swollen, it's red, and I can actually see in the joint that there is some joint damage. Then I say I have arthritis, and I feel like, yes, I know for sure this is what I have. What we have more trouble with is diagnoses that do not have a very physical test that can confirm that, right? And, you know, honestly, you and I as psychologists, our mental health diagnoses are kind of like that, right? Like if somebody is having mood symptoms and is feeling like they're not enjoying anything and so on, we say, okay, you probably have this, or you may have anxiety or something. So many of our diagnoses are symptom-based, right? But that doesn't mean it's any less real. So the way I think about fibromyalgia is that we do not yet have a specific test, even though we know that there are changes in the brain, okay? There are probably changes as well at the blood level or an immune level, but they are just not clinically diagnostic enough that we can say, oh, this is specific to fibromyalgia and doesn't occur. Now, using artificial intelligence, this is all again on the research side and machine learning, they're actually looking for something that is like a signature in the brain, like which is a pattern of things, of the way your brain interprets pain stimulus. That could be like a fibromyalgia signature. That has not gotten into clinical use yet, but there are some signs working towards that. So I know from a family's perspective, it's kind of unsatisfying because it is still symptom-based. And not only that, the doctors haven't yet agreed on specifically what symptoms come under that. But I would honestly, if I were to speak with a family about this, I would say, look, the way this is currently, your child is saying these are the sorts of symptoms they're experiencing. I would not at all dismiss any of those symptoms and say, yes, this is recognizable, because there are other people that also have these very unique cluster of symptoms like this. So it is a syndrome that is a real thing. It's just that there isn't no very specific medical test for it right now, but that doesn't make it any less real. So I wouldn't, so this was one of the interesting conversations we had with some of the young women who had been identified earlier. They said sometimes it took them a while to wrap their head around the fact that they had the diagnosis themselves. Even if the doctor said, well, it looks like this is fibromyalgia, and they were like, well, that's really not a thing. And, as a teen, you just want to be like everyone else and be totally normal and everything. And that's fine. But it was like only when they just sort of accepted that, yeah, I guess I've got something going on, then they were ready to partake in the treatments that were offered to them. But there was a time where they were still sort of struggling. Is this what I have, what I not? And sometimes they went to multiple doctors. And then it was when they started to just start to hear the same thing that they were just like, okay, maybe this is what we're dealing with. So it is excruciatingly hard. I completely understand, because sometimes people don't arrive at the fibromyalgia diagnosis until they might have seen neurology for headaches. They might have seen GI for, gastrointestinal symptoms. They may have seen genetics because they had, hypermobility in their joints. And so they may go through multiple specialists, and then someone says they have fibromyalgia, and they're just like, well, what is that really? And so
Exactly.
I understand the uncertainty around it, but we're trying to make this better.
Absolutely. Looking at the time, if it's okay, so we're right at 11. I'll squeeze one more question in because I'm going to combine a couple questions that came in through the chat. And I think what they're getting at is, is there any research, are there any data looking at subpopulations in youth with fibromyalgia, including trans youth and also neurodivergent youth?
That's a really good question as well. We have, like even in our 15 study, which was the largest treatment study to date, we systematically tracked, the gender identification of the youth and so on. We did not address the neurodiversity angle as directly, because we didn't have like complete assessments around that, or collect specific diagnoses. We had about, out of the 300, I would say about a little less than, it was about 8% or identified as trans. And we have not completed analysis of the subgroup analysis. What I can say is, and this is purely anecdotal from our clinics and from also some of the patients that participated in our studies, is they were sort of dealing with sort of intersectional stigma, right? Because it has to do with, you have this condition that, with fibromyalgia, it's uncertain that, is it a medical condition? What is it and what's going on? Plus some of the issues that come around, the social issues that come with the trans teens in our study. So many of them had sort of multiple things that they were coping with, and that made things a little bit more difficult. I mean, they were happy to be engaged in our study to sort of deal with the fibromyalgia. And interestingly, the other teens that participated as part of those groups, it really helped that there were other teens that were experiencing similar problems and were very open and accepting of, and the way we designed our groups as well, we were very open about, using the appropriate pronouns and making people feel as comfortable as possible in the group situation. And so the trainers were very aware of that. So we do have a subpopulation. On the research side, we haven't tracked yet, but now that we are also becoming more aware of some of these issues from the patients with lived experience communities as well. So as part of the HEAL initiative, I've been talking a lot with many of the subcommittees about some of these issues surrounding neurodiversity, as well as the trans community, and addressing those in pain as well. So
Wonderful to
much work needs to
hear.
happen.
Yes, and we look forward to the continued work that you and your team are doing. I'd like to thank you so much again, Dr. Kashikar-Zuck, for being here today, and thank you all for joining us. This was really a treat for us all.
Thank you. Thanks so much.